A few words of welcome from my side. Let me first start by saying we're recording this session purely for our collective, ability to go back and listen through to the billion things that each of us are working on. If you have any objection, please speak up. Otherwise, we'll assume that everyone consents. This meeting is, I'll say, the second in what I think is becoming a series of discussions around health accountability, and that some of us have been having, and offline, online, in our communities as well, of course, and that we're eager to keep on pushing so that we can learn from each other, share about what we're doing, and hopefully out of that experience exchange, all of our work can be stronger as well. And so, as many of you are aware, our intent is for this meeting today to be as informal as possible. We're not here to give NGO presentation, but rather to talk about experiences that we're having, and hopefully for as much of the time to be reserved for those of you paralegals and health advocates, and less time for people like me and others that work for NGOs. So now that I've spoken plenty, I'm just going to give a few words of our agenda, and then we're going to dive right in. And first, before we really get into the heart of health justice issues, we're going to share a quick, a 4-minute video that is about one of our colleagues here in Lagos, a man named Sangoloke, who is doing some amazing paralegal work. And although the video isn't as much about his health work, it's, I think, a really inspiring place to start and sets us in a context in which all of us are working. And I think probably you'll all see it and you'll say, I know that place, even if you haven't been to that place. And then we're going to do a round of introductions by paralegals, talking about their own community briefly, and what your community is, who your community is, where your community is. And from there, we're going to dive into some sharing of health justice challenges or cases that we're all working on. Hopefully with ample chance for question and answer. And please use the raised hand function or use the physical raised hand like this, and hopefully I'll see you and then you can come in. Of course, we hope to, out of that, touch on some successes from each of our work, and then also talk a little bit about kind of how we can support each other more. Of course, we're just getting to know each other, but I think one of our goals is really about how we can support one another, collaborate, encourage one another, because all of us know that to do this work, we need lots of encouragement and collaboration too. Without any further ado, we're going to play a short video. Mutano, can you take it away?
Amy, are you going to do it? Okay. I'm sorry, guys, in advance. We've been working on how to play this video for like the last 5 minutes. So this is the best way we got to do it.
Sorry, Mutano, I
Hello,
actually couldn't hear you very clearly.
hello,
Aha, beautiful.
hello. I observe.
My name is Moses Changoloke. I'm a community paralegal trained by Justice Empowerment Initiative. So I have 4 children. My first daughter is Chei Sang. The second was a twins, 2 girls.
Mutano, it seems to be breaking on my side.
Sorry, yes.
You'll just screen share, give me screen sharing, and I can try to play it from here.
Yes, please. Andrew, you can share your screen.
Okay, here we are. Let's see.
My name is Moses Changoloke. I'm a community paralegal trained by Justice Empowerment Initiative. So I have 4 children.
I think we lost the volume. I don't know if it's just me. I can see the video, but I can't hear the words. I mean, I can't hear anything.
Yeah, we lost the audio, Andrew.
From the government because
Sorry, is it still not playing?
people as not they discriminate. Paralegal is someone that has been trained. We hear some people saying on our way coming back from the river, policemen start telling us that we should give them fish. If they refuse, the policemen will tell them we'll arrest you. So apart from that, policemen arrest people that don't commit any crime. I want to give an instance of first case that I handled. They call the person Daniel. I was arrested in lieu. Arrest in lieu is arrest somebody in place of another person. They arrested 4 people. So other 3 people, they paid 300,000 to search me before they released the 3. The other one that reported is to me, release him without collecting any kobo. So people see me as a messiah in that community because apart from the community presentation where we educate people about their rights, I assist a lot of people free of charge. To be a paralegal, you have to love people, because these people that you are going to assist, they don't have money. If you don't love them, you see them suffering. And you just, by the way, because you won't mind it. But if love is here, educate yourself that, okay, this person, this particular person, I'll make sure that it was released, it must get justice in this matter. So that is why I just keep pushing myself. I don't know what tomorrow will bring, but I'm not going to give up. I just want to try more and assist people in my community.
Now, that's your ideal class, and therefore I'd like to ask you now, how far
And so hopefully that set a bit of context for all of us. Apologies if the audio wasn't great. Mutana will drop the link in the chat, and for anyone that wants to watch it later, you can easily watch it. The next thing that we are going to do is talk a little bit about community. Because community is where all of our work begins, and at the end of the day, where all of our work ends. And so we're going to go around the room, and for the community paralegals that are with us, and the request is for you to describe your community, whether where you live or where you work, or who are your community. In as few words as possible, so that we can get around the house quickly. I'm going to call on my colleague Mohammed Zana, because he's right next to me. And then from here, we're going to jump to Sierra Leone. So prepare yourselves.
Yeah, good afternoon once again. My name is Comrade Mohammed Zana. I'm the National Coordinator of Physically Challenged Empowerment Initiatives in Nigeria. My community is a grassroots movement of people living with disability across Lagos State and even beyond. And these are the most vulnerable communities here in Lagos State, a city of over 24 million people and growing. There is about 2.something million people living with disability in Lagos State. So, as a community paralegal trained by Justice and Empowerment Initiative, we do our best to see that we provide assistance and support to this vast community of vulnerable people.
Thank you.
Good afternoon, everyone. My name is Akatina Ilola from Nigeria Justice and Empowerment Initiative. I live in a community where majority of them are fishermen in the waterfront, and we face many challenges of health, no health facility, and even no sources of livelihood to anyone, because we face the challenges of naval officers chasing them morning and night. But as a paralegal, we try to encourage them that if they are not guilty of anything, there is no need for them to be running up at them. And we gather ourselves as a paralegal and face the challenges from those Navy officers when they came around. Even when they collect their working tools and all those things, we try to encourage them and go to them and collect it back. Thank you.
Wonderful. So, over to you, colleagues in Sierra Leone. We'd love to hear who is your community, and if we could go around the room, that would be wonderful.
Who is the community?
Once more, I am John Momo Salia, working for Methodist Church Radio, a community-based paralegal. My community, of course, is the Bom District, which is one of the 16 districts in Sierra Leone and the most deprived community so far in Sierra Leone. The inhabitants of Bom District mainly got their livelihood from fishing and farming. These people have been deprived for decades in accessing, quality health service. So we are working together in order to ensure that this community get access to quality health service delivery from the government of Sierra Leone. Thank you.
I'm Mangwana Escalon, once more, representing Network Movement for Democracy and Human Rights of the NMD Charo. I'm from Kailahun. I'm representing Kailahun District as a paralegal. Actually, Kailahun is one of the districts which founded between Guinea and Liberia. The system of living there as a livelihood probably based on farming. There are a lot of farmers there. That is the area I'm coming from. So this district has so many challenges, more especially when it is found between the two borders, which is Liberia and Guinea. Actually, now I'm sitting here. There's a greater challenge here because people always go in and out. Like even when we are talking about the free healthcare, there's a problem in Sierra Leone because those two countries and policies always infiltrated into Sierra Leone and congest the total drugs from Kailahun and get back because they are interrelated. Thank you very much.
Yes.
Yeah, good afternoon again. I'm Betty Mojo from Bond District, John Chipdon to be specific. I'm working with paralegal as community health monitor. We monitor the health centers and the queue for patients flow. Before this time, patients were reluctant to visit the community health places because of one or two reasons, because they were grumbling about the medicine that the government is supplying. Most of the essential drugs are not available. But with our intervention, we try to mediate between the nurses and the community people. We talk to them, we encourage them to visit the community health post so that whatever drugs is available is for them. But in previous years, the understanding was not there. They said all the drugs is for everybody, but that is not so. The medicine is for the lactating mothers, the under 5, and the pregnant women. But that education was not there. But through the paralegal intervention, they have got that understanding and they are working amicably with the paralegal. Thank you.
Once more, my name is Edmond Lavalley from
Can you turn the camera so that we can see who is talking? Aha, better. Thank you.
Once more, my name is Edmond Salapali from Kailahun community, preferably Mofino village, where I was born. This community is deplorable through health service delivery. I was trained by a paralegal from Network Movement of Democracy so that we can try to educate our people to understand the drugs that is supplied by the government. Whosoever, who are the beneficiaries of this drug supply for primary health care in our health post. So we try to tell our people that the drug supply is not for everybody, but the people who are entitled to these drugs supplied by the Ministry of Health and Sanitation are pregnant women, lactating mother, Ebola survivors, and old age group. But the drug supply sometimes are not enough to really cater for the needs of people. So therefore, we need a greater help to improve the primary health care in our community. I thank you all.
Wonderful, thank you. I believe that's all the colleagues from Sierra Leone, am I right?
Yeah, that's the team from Sierra Leone.
Wonderful, wonderful. Welcome. Can we jump to our colleagues in Mozambique to tell us who is your community? What does your community look like? Where is your community?
Okay. Hi everyone. Once again. So Geraldo, Fatima, and also Malo. But we can just start with Fatima. Fatima, you can describe your community, what are you doing also?
Go ahead, Fatima.
I have got with my net, but I will try now. Hello everyone, my name is Fatima Isufu. I'm from Mozambique. I am a health advocate here. Our work is linked to legal empowerment of communities and in the defense and the promotion of the right to health. About my community, unfortunately, have got the policy of silence is very dominating in our community. We have powerful laws, but they are not put in action. So we find ourselves fighting a very big fight, but we count on communities members who they'll fight for the rights of their communities.
Hello.
Hi, Artur.
Oh, thanks. I will bring here some information related to the Inyambane community where I'm based. Really, the Mozambican people, they are silent. They are not very active in exposing their difficulty, but it's because of the political system. Our political system here is very dangerous. So the people is not very open in order to bring their issues. Talking about Inyambane community, it's a multicultural community with the 5 languages, local languages. I'm talking about the local language. There are also 5. That's why it's very difficult. It's sometimes difficult to work in a different places here in the province, but we are working because we have distributed in a different, according to our provenience. For example, I'm here in the district where I was born, that it facilitates my communication with the people. That's why I know how to interact with them. It's very, very, very fun to work with them. So we work in this way with our people here, our community here. That's why we are able to identify all the issue and solve it. Because I'm here, I'm in my place. I know how to interact with my people here in my local place. It was I had to say. Thank you.
Hello, everyone. Hello.
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 Hi,
Please.
Geraldo.
Hi,
Geraldo.
Yes, I'm Geraldo. I'm from Mozambique, in Yambani, and I work in Jangamo district. As what my colleagues were saying, here our communities has silence politica. Right? They are not open. Our communities here are not open to say what they think, to fight for their rights. But ourselves as health advocates, we're trying to bring another light. We're trying to bring a light for our communities. We are teaching them to teach each other, right? We are teaching the politicals and laws, and just to make sure that they can fight for their rights, because if they still in silence, there is no possibility to change what is wrong happening nowadays. So we are working with the health committees, co-management committees, and the health workers to change the way the health system is going on. It's not easy. It's quite difficult because sometimes we find people who are not open sufficiently to receive what we are teaching and to be with us, because our work, it depends on the way people are open to receive it. Because if people are not open to change the reality, there is no possibility to make them change. But we are trying to change the way they're thinking, to change their minds, to adhere the critical conscience. So it's something. It's not easy. It's not easy, but we are facing it, and we are changing minds. We're changing minds, not alone, but with the health committees and all the community we're working with. Thank you.
Thank you, Geraldo.
Hello.
Yes, Eduardo, are there other colleagues from Mozambique, or that was the
Yeah, so I would like to underline some issues that my colleagues bring. So in general, we're empowering community to know the law, use law, and shape law. The legal empowerment observed 3 transformations that we believe that when we bring on the community will changing life. As Geraldo says, and Arturo says, that our community in Mozambique, in our reality, we have a good police, we have a good protocols and law, but in practice, we are not feel it in terms of service in the health facilities. So we're trying to teach the community just to know the law and use the law. No law in the health facility, for example, we're teaching them which service is supposed to receive when they go to the hospital, for example, and how to ask if something is not going well in terms of the service of health. So, and also we are working with the health of Minister of Health, just to making a change in the protocols, because sometimes they write protocol that is not for adapted for the community. So in that way, we are working in the health Minister of Health, just to transform the protocols and the strategy, just to bring more delivery of service in the health facility. So I would like to underline these three lines. Sorry, thank you.
Wonderful, thank you, Eduardo, and really, I think resonates with a lot of, I'm sure, what all of us are doing in our different contexts. And can I ask colleagues in Tanzania to say a few words about your community? And I'll just try to be brief, because we're going to get to the real substance of the call afterwards. But we want to know where you are, who you are, and yeah, who are your community? And then we'll jump to Iwe before we get to the next part of our conversation.
Thank you so much. Yes, so from Tanzania, we have Ali Omari, Shani Hussein, Cletus Nziku. So some of them are using one computer through the username of Aisha. I will just kindly ask them to turn their cameras on. And if you'll allow me, I will be speaking both English and Kiswahili, just translating for them, and also speaking in English for the rest of the people in this platform. Yes, so please allow me to welcome them. Karibuni sana washiriki kutoka Tanzania. Nimeambiwa kwamba mpo pamoja kwenye laptop ya Aisha. Kwa hiyo karibuni, naombeni muwashe kamera ili tuweze kuwaona, na karibuni mjitambulishe, mtuambie jamii yenu ni jamii gani na mnafanya kazi gani. Welcome.
Ali Omari, after Ustawi.
Yes, his name is Ali Omari. He's a social aid worker. Karibu.
Hello, Rachel. Can I speak on behalf of Shani because there's impaired vision?
Yes, you're welcome, Aisha.
Thank you. I'm Aisha Santu, Executive Director from Growing Future Foundation, an NGO which is hosting our paralegals and social workers. Shani Hussein is among the community members, because in Tanzania we try to have a mix of paralegals, social workers, plus community members to talk on the health and health rights. And on their behalf, I can talk that in Tanzania there are a good number of policies governing the health issues, but we see that on emphasizing of these policies has been a hard work. For example, we are allowed, the elders are allowed from the age of 60 years old to be treated for free in the hospitals, but also the kids below from 5 years old and below are treated for free. But we can see that there is a lot of bureaucracy in attaining these services. But on the other side, we see that people with disabilities are at least treated better in the hospitals, but when they arrive, they're treated fast while others are waiting. Thank you. And I believe if Cletus has an addition to that, he can add. He's a paralegal.
Welcome, Cletus. Thank you so much, Aisha. Asante sana, nashukuru. Karibu, Cletus. Welcome, Cletus. I think he's online. I don't know what name he's using. Cletus, kama upo, karibu sana. Okay, I will check with him. Let me check on him in the chat box. But while I reach out to him, I just wanted to also add a little bit about the healthcare system in Tanzania and just the overall environment. So I'm a lawyer, and even thinking about it from a legal perspective, I do know that one of the challenges we still have in Tanzania with the healthcare system and the community paralegal system is there is a lack of knowledge or legal knowledge, if I can say, that is being provided. A lot of people do not know about their rights, specifically in relation to health. You know, a mother doesn't know her rights, you know, when she was pregnant, that she deserves this and this kind of treatment from the hospital. A young child, a young girl, people with disabilities. I know many times, even in these discussions, we tend to forget people with disabilities, but they also have their rights. And even with the laws that we have in Tanzania, which are doing a good job, I must say, and they keep improving. But a lot of people, especially people in the rural areas, are not being reached out to enough about the legal knowledge on their health rights. So that is something that even me as a lawyer and other fellow lawyers in the country, we try our best to bring those programs. We try our best to raise such issues and educate people and make sure that they do know the law is protecting them and that they do have a right to demand to get those health services, good services, not just normal services, but good services from the different health facilities, clinics, and hospitals. So I believe even later on in our discussion, Aisha and Ali Omari and Shani and the others will be able to contribute to that and give more feedback on the current issue in Tanzania. Thank you.
Thank you, Asante Sana, and Obrigada as well. And really appreciate all of those contributions. And last but certainly not least, Koalition Highway. And could you tell us about your community? What does it look like? How do you define community where you work? Ishmael or Hafsa, would you like to come in?
Ismail.
Hi, everyone.
Wonderful, welcome. Over to you.
Hi, everyone.
So sorry.
Hi, everyone.
Hello, Hafsat.
Hi, I'm Sawali Empowerment Initiative, and with me I have my assistant and our two.
Okay, we'll be translating what they will be saying because they have a bit of problem with English. They will be speaking in Hausa. So, but I or my assistant will be translating what they say. So they are going to give us a bit about their community.
Hafsat,
yeah?
Hafsat, it's the rest of us that have a problem with Hausa, not your colleagues that have a problem with English. But we'll manage.
All right, thank you. Thank you very much. Okay, I think over to them.
Okay, good day, everyone. I am Muazu Umar Muazu from Isawali Empowerment Initiative. I'm a lawyer and the Assistant Legal Empowerment Officer here. So I have been working with the paralegals for some time, and I really appreciate the work they do. And here with me are some of the paralegals. We have two paralegals here, and I know they would like to introduce themselves.
I am good afternoon. My name is Kamis Kabiru Dalasan, a paralegal from Warawa local government, and also a trained paralegal by Isawali Empowerment Initiative.
Hello, everyone. My name is Hanima Musa, paralegal from
Isawali, paralegal from Bichi, local government of Kano State. We were, I'm paralegal from Isawali Empowerment. We were trained by Highway as a community-based paralegals. And we were trained to provide free legal aid services at our community.
I know the paralegals will be willing to contribute a lot to this session.
Okay, as she said, they were trained to provide free legal aid services at their communities, and we work with the grassroots. They come from LGS of Kano State. She's from Bichi and Kamis is from Warawa. So basically they work as paralegals on the justice aspect. Can everyone hear me?
Yeah.
Yes.
I hear you.
Okay.
Yeah.
They work on the justice aspect, but along the line, maybe they might have clients that may bring medical issues to them. So they have undergone, they have experience on maybe dealing with clients and hospitals. So not basically working as health advocates, but having experience because of their work as paralegals and fighting for rights of people. So this is basically what they do at their communities.
Wonderful.
Looking at the fact that health right is a legal right. So the paralegals want to enforce legal rights, and so they may move to enforce health rights also, because health right is a legal right which needs to be enforced.
And absolutely, and I think that very much resonates with echoes what colleagues in Tanzania and Mozambique and Sierra Leone also shared about the challenge being enforcing the laws and fulfilling those rights. And I want to say a huge thank you to everyone. I think it's really nice that we know each other's context a bit, because it's from that context that we, in that context in which we're working, and I think from that context that we can equally draw parallels and understand challenges and differences and in our respective work. The next section, the next part of this conversation is intended to be focused on specific examples of the kinds of cases or challenges that we're working on. And I will just make this one request. If we can focus on like an individual case, everyone is welcome to share, but if you can share an individual case that you have personally worked on, I think that would be very rich and interesting to the rest of us. So I think we'll go roughly in the same order, but everyone should be ready to ask questions and make contributions as need be. And we should be time conscious. So I'm going to start with my colleague Mohammed, since I'm here and I can off his microphone when I know he's talked too much. So Mohammed, over to you. A specific case that you want to share with the rest of the house, starting from the very beginning. So,
yeah, thank you very much for the opportunity. I want to share a personal experience actually. A couple of months ago, I was seriously sick, and one of our colleagues who was here working with us happened to turn test positive for coronavirus, which means people like me become suspect that we need to go and equally have a medical test to be sure that we are not coronavirus positive. And getting to the healthcare facility, it is a little distance away from the office. And not knowing that I have corona or not, I try to avoid taking public transport so as not to endanger other people. I trek from our office down to the hospital. And unfortunately, I wasn't with my phone. My phone has went off, so I plugged it to charge in the office while I went to the hospital. But by the time I get to the hospital, I was asked to register online for me to be tested. And I was like, I wasn't here with my phone. They said, well, there's nothing they can do about it. So which is a major challenge for many people in the kind of the community that I work, because most of them don't have Android phone. And then even the few that have Android phone, they only know to download video or share video through Bluetooth and Sender and watch those videos, but not actually go online and download music or email or have any of those experience. So for the registration to be only online, it is a serious challenge. And at the end of the day, I couldn't get tested. I have to walk back home again because there is no provision within the facility to provide such assistance to vulnerable groups that might not have Android phone for them to go online and register online. And as you can see, the coronavirus is not going anywhere. We just have the latest one, Omicron. So there's need for health facilities to provide facilities for the vulnerable people in my class that cannot have access to internet or have the capacity to go online. And one other experience I also have was in the area of vaccination or other vaccination like hepatitis B vaccination. When in some part of this country here in Nigeria, it is free of charge to people of all ages. But when I go to Lagos here, I will try to access this vaccine. The vaccine, you cannot access it in the state hospital. You have to go to private hospital, and it's going to cost you a huge amount of money, something that ought to be free, and legally it is free. But somehow it has been diverted to private hospital, so you cannot get a such vaccine unless you go to a private hospital and pay a huge amount of money before you can be vaccinated. And this put a lot of people in danger, because if people cannot access this vaccination, then many people are at risk of contacting different diseases that should have been preventable. So under the Lagos State Special People's Law, there's a provision that people with disability are entitled to free medical services. But yet, if you go to those health facilities, you can't access those free medical services because there is one bureaucracy or the other. These are the things we are working in our own community to try to change with the support of justice and empowerment initiatives. Even though in some cases we do succeed to argue with the hospital management to consider a person that is disability by law, he is entitled. We do have some cases where an accident victim, we went to get the body for burial, they have to charge us like 58,000 naira, and we now have to argue that under the law, this person that is living with disability, he should not pay that much amount of money for such services, and they were able to argue it down to 30,000 naira based on that very law. Thank you very much.
Thank you, Mohammed. So a variety of different challenges that he shared. Would you like to share some challenges and equally, hopefully, some steps that you took to try to overcome the challenges? Because I think that's equally inspiring.
Good afternoon, everyone. In my community, there is no health centers. So the only health center that we use is the next community health centers. But this is a health center that if pregnant women go there for attention, sometimes we don't see anybody. The health center might be closed up for 2 to 3 months. You will not see anybody. So when I gave birth, I was like, this child must collect all the necessary vaccination. And I got there the first time, I met the doctor. When I see the doctor there, he's my very good friend. I know him from his own private hospital, which I know very well, I used to it. I asked the man, are you the one working there? The man said, yes. I said, well done. I collected the vaccination for the first dose. The second dose, I went there, it's not there again. The primary health center is locked up. I was like, why? I didn't call. I went back. I take my card to other health centers. They said they will not attend to me, that there's no doctor's signature there. So I was like baffled. Why would this happen? This next week again, I go to the health center, lock up. I get angry and now call the doctor. The doctor said it's not available, that he can't come to the health center. And now called him on phone that if anything happens to this child, you will be held responsible because he collected the job to attend to all the children. Do you know the numerous children that you will be affected with this, your carelessness of collecting the job and not attending to those children? The man said I should come down to his own private hospital. I take bike, I go there. The man was like, okay, let me attend to you here and go to your home. I cannot go there. I said, no, you must go there to attend to them because there are many children there that is waiting for you for attention. The man in annoyance take the bike that I took, go there, left me in his hospital. When I now go there, we take the vaccination for that day. I said, okay. The man now called me that it's not done like that. He just managed to collect the job since others, doctor said he's not going there. I said, you're supposed to reject this job when you know that you are not capable of doing it. So what my second challenge is in the area of health facility concerning drugs and other things. I get to a notice that government usually provide drugs for pregnant women free of charge when they are tested on one disease or the other. Because I formerly used a hospital here in Lagos, where when I'm pregnant, they give me more than 40 malaria drugs for free back in 2012. But when the hospital folded up, I go to a well-known primary health center, belongs to government personally, which is Lagos State that operates it. And they told me that these things are not available. They will write it for me, that I should go to their pharmacy and plug those drugs. When I get there, they charge me. I was like, this thing outside is not sell like this. Your price is high, then I will not buy. They now tell me that they can't attend to me anymore if I don't buy from them. I was like, okay, if I didn't buy for them, you won't attend to me. Then if I die, my spirit will be chasing you up and down. The woman like, okay, do your worst. We are not going to attend to you again. I was like, then I'm not going to come back. I will go to a traditional practitioner for delivery. After a while, I get home, I talk to my brothers. When I talk to my brothers concerning the scenario, my brother said, okay, the next day we'll go there. My brother followed me to that place because my brother is a government doctor. My brother now followed me to that place. The same description we give to them is my brother that give it to them. So when we get there, we give the list to the woman. The woman brought out the drug. My brother said, how much is our money? The woman said, it's free. I opened my mouth. Why is it free? But you told me yesterday that this drug is 4,800. He said, it's not in that, it's free. I was like, okay. Is it when we are ignorant of ourselves? That is why we use ourselves. The woman now said, when we are Nigeria, we're not going to eat. I said, even though you want to eat, you don't like, you are not gluten. You need to eat normal. That is how we became friends. And since that day, if I go there, they didn't take money for drugs from me again. So we are like, when we don't know the laws, they will be playing on us. When we don't know our rights concerning health, we will be pushed to and fro like tire. So we need to educate people on how to handle things in a normal way. It's not everything we do with isn't it that I'm going home, let me just give them. If you give them today, we will not encourage others to fight them for their right, and they will continue. But if they see two faces of challenges or the others, they will think that this person might know the law and minimize the way that they do things in the wrong way. So it's not everything we pay for. It's not everything we need to say, let go by it. We need to fight when the times come to create room for others that is not having the privilege to pay for some things. Because all these things are our rights. Concerning health centers, we have some rights. Everything is not made money. But when we don't fight and we said we are time conscious, we need to go home, we need to do this, all other will be affected. It's not only us. Thank you.
Wonderful. And so you've just heard two testimonies, including lots of challenges of corruption that affect us here, and equally some creative ways of bringing pressure to affect accountability, which I think is the whole focus of this call and this conversation. Thank you both. And can we jump to colleagues in Sierra Leone to share individual cases, individual challenges that you're working on currently and that you can share with the rest of us?
All right, I'm John again, working for Methodist Church Sierra Leone, a community-based paralegal, working in Bond District. We are using the community compact meeting as one of the strategies in the legal empowerment program. During this meeting, we normally allow the community people to raise their concerns with regards to the health service delivery. And also, we encourage the health workers or the health service providers to also raise concern, they have with the community people that do affect their normal operations. During one of the meetings in July this year, 2021, there was a concern raised by one pregnant woman, that when normally they get to the facility during clinic days, the facility staff will tell them to clean the environment of the facility before they could attend to them. So that issue was brought up, we discussed around it. During the meeting, we clearly told the facility staff that it is not the responsibility of patients to clean the compound, but the responsibility of the youth in that community. So during the meeting, we set up an action plan that the youth of that community should mobilize themselves, in order to clean the facility. So that was the first instance. The second instance, which is the first follow-up on that meeting, having set the action plan, because of course, in one person raised the concern, but we observe that that is happening in most of the other facilities, that facility staff normally ask patients to do cleaning at the facility during clinic days. So after the first engagement, we gave them 3-month intervals. As recent as October, we made a follow-up meeting again in that community. So we observed that, and the community people clearly, confess that such an attitude or action has stopped by the facility staff. And the reason why, according to the facility staff, they normally ask the patients to clean the facility is that the cooperation of the community towards cleaning the facility is somehow not encouraging. So they said they are using that as a means of, igniting the community, to get into action in order to clean the facility or to help them in the cleaning of the facility. And most times, the wives of the youths normally visit the facility. So that issue was resolved by allowing the youths to mobilize themselves, to clean the facility. As recent, during that meeting, we saw the facility well clean, and that has been a sort of bylaw now set by the community with the help of the chiefs and other stakeholders, that at the end of every month, the youth should get to the facility and do brushing and other necessary cleaning around the facility. That's just one of the issues that we've been working on.
Yes. I'm Mangwana Escalon once more, representing Network Movement for Democracy and Human Rights. In related to one of the cases which my mother just talks about, I too just solved that problem during August 2021. There is me sitting here. I visited one of the facility community which called Sandia, which close by the Liberia border. Actually, one lactating mothers were deprived by the facility in charge because of she also paid to do a cleaning, in the sense that she was not feeling bright and she did not take any excuse from the FMC, which is the facility management committee members, on Saturday. So it reached on Monday, it was the operational day for the clinic. Then she went there with her child. Actually, this child was deprived because of one, what I understood, this in charge are not properly dealing with the law and the policies based on the free healthcare basis and the primary healthcare service delivery. So what happened? I called the FMC, the community stakeholders, and comparted with them. Then the woman explained that this is what has happened to her. Then categorically in my presence as a paralegal, this in charge denied that she's not the one that did so. Then the woman said, no, you are the one. In fact, he asked me that she asked her that not even to reach at the facility. Here comes, I gave a responsibility to the facility management committee that they are not operating, because if they are operating, visiting that facility, such thing could not happen. So with this, we comparted them, they will explain the law to them more, but let the even the in charge know how to use those laws and policies based on this free health care. Likewise, the authority also, we are so happy that they have understood now this is what the policy that is guiding them based on the health system. So actually, this woman and her child was treated. Then the others, community people also look at it now that, no, we are not responsible to do the cleaning. We have understood now that today, the FMC, who are the facility management committee, are responsible to enhance the good quality and service delivery towards our facility. Likewise, we as beneficiaries, we are married. Our men are responsible to do the hospital cleaning. So from that point on to now, actually, they are continuing to do cleaning in the hospital. The men, not actually the female. Thank you. Okay, the challenges now, in fact, like the 22 community I'm serving as a paralegal for Kailang district, I'm covering, this project is covering 2 chiefdoms, Wendu, Kisitungi, and Rawa. Kisitungi have 5 facility community, likewise Rawa, 17 facility communities. The challenge are so many, but the most one that we saw on the ground, it was based on this home delivery. Not knowing that those TBAs are looking at it that that is the area they too can lead. Why it is not so according to the policy and the laws in Sierra Leone. So these people always do home delivery. But after we have changed the facility in charge, this also the facility management members from this point now, they went to their community back and create a bylaws on those days that it is not good for it to be done, because They never knew the effects and causes of it, but now they have understood it. They have avoided doing those things now in their community, because why TBE are doing home delivery is because of they thought it is their own area to live. They forgot about the risk of it. But presently today, according to our intervention, they have understood it. They too have set a bylaws against those things within the communities. It has stopped. As now I'm talking, it has stopped actually. And we are always doing a follow-up within those communities. We have never seen anything like that again. Thank you.
Yeah, Madam Betty Bodge, one district. Our challenges are too many because our district is a peculiar district. We have the riverine and we have the mainland. Sometimes even the terrain, the road, the poor network road, and even the communication, the poor network. The poor network is really disturbing us, because sometimes when you visit some PHUs or health centers, you want to call your facility management person, you will not be able to even talk to him or her. So those are challenges. Then even sometimes the patients are reluctant to visit the facility because of the attitude of some health workers. But with our intervention, that has been minimized. But it's a challenge, because some people are illiterate, they don't know, they even don't know what is going on unless we educate them. So that is our challenge. And some of the nurses, their challenges are some of them are not on payroll. They have served for 5 years, 6 years, and even where they sleep, there's no facility for them. So that is a very big challenge in our district. Thank you.
Once more, I'm Edmond Salapali, FMC from Kailaung. We have so many challenges towards health care facilities in our villages, in our communities. One, light facility. Most of the villages we are working in, there's no light. Even in our delivery rooms, in those attachment villages, no light facilities there. When time comes for delivery, the health workers sometimes demand batteries from those pregnant women so that they will use it to do the delivery. Another is that there's on our attachment areas, there's no garbage area provided to control the afterbirth in those communities. So at the end of the day, the community is polluted with what? These waste materials from the hospital or the clinic. We have another great problem or challenge is that water within the community, we have water facilities in those areas. So therefore, these are some of the challenges that we are facing in the community where we are working. Thank you.
Thank you very much. And my goodness, lots of challenges, lots of different strategies being used in Sierra Leone. Thank you for sharing all of that. Quite inspiring work, particularly to tackle those different challenges. And I wonder if our colleagues in Mozambique want to share one or two cases, specific cases, individual cases that you've worked on and that highlight some of the common challenges and strategies that you use.
Oh, hello.
Go ahead, Artur.
I was trying to.
Hi.
Oh yeah, thank you. I was trying to put in the video here. So really, we have faced issue to the heat here in Mozambique. So our issues here are divided. We have some issues related with the infrastructures, another issues related to the material and the medicines. Another issues are related to the behavior of the the health facilities. For example, talking about the behavior, for example, the charges, the illicit charges in some service which are not payable, the facilities, sometimes they charge the patients. They used to charge them, or how they give the information to the patients in the hospitals. So we are dealing with these issues. I will bring here some examples of infrastructure. For example, in a Agostinho Neto Health Center where I'm working, we had an issue related to the infrastructures, where the maternity house was very damaged, very damaged. Sometimes when it rains, it's too filled with water, and the power cable was there. Yeah, things like that. Everything was different. Sometimes was necessary to interrupt to receive the maternity deliverings in that center. So what we did in order to solve this issue, firstly, we met with the director of the center here in order to talk, in order to bring some solutions, but it was not possible because of the costs of rebuilding in that hospital, in that center. It was not possible. So we passed the issue, the case, to the district director. We meet with the director of the district. Also, he didn't solve it. He didn't solve. So we asked the support of our program officials here in order to help us. What we did with them, we wrote a letter. We wrote a letter where we mobilized people, the community of that health center, in order to sign this letter. In order to sign this letter, so they can expose their necessities in that letter. We took the letter, we submitted the letter to the district government, to the municipality president. So from there, in the letter, we submitted another health centers of the Mashishi district where I'm working. So months later, the government started to rebuild the health centers in these conditions, starting by Agostinho Neto Center. It was rebuilt last year. So now we have this health center in good conditions. Everyone can go there, is well received, is nicely received. So we deal in this way with some issues related to the health center. Thanks for everyone.
Thank you and congratulations.
Madam?
Hello, everyone. I'm going to say another case that I'm following up. During my activities in Kumbana is one of the hospitals in the Jangamus district where I'm working. During the activities in the community in Masalela 2, a man raised a hand and shared his concern related to mismanagement of a hospital west at the health center, where he said that the hospital west was incinerated in a pit, and when they burned it, some remains were left scattered, and when blowing, it spread across the area around the health unity. And the domestic animals also easily had access to the surgical and biological material that were discarded in the pit used for incineration.
And he shared that one day he came back home and faced a situation where his son was using as toy surgical material used in the hospital because he lives nearby the hospital. And it was very uncomfortable for him, and he got very scared. But after receiving this issue, in coordination with the health committee, we forwarded the case to the person who is responsible for the user's office, and together with this, we went to present the case to the responsible for the management hospital West, and to the person responsible for public health in the hospital, where they stated that the case was known to them, and that the same was due to the breakdown of the incinerator, but that they have already reported it to the management of the health unity, but still have not had a satisfactory response. Then we followed the case at the management level, and we met with the person in charge of the health unity. And she said that at the local level, they are not conditioned to solve or to resolve the case, but it was reported to the direction of the district health service. But they have still not received a satisfactory response, despite the pressure they have been exercising. And it was suggested that the case to be discussed at the level of the co-management and humanization committee. So during the meeting with the co-management committee, as a way to solve the case, it was decided to prepare a petition to the district board. So where the district directorate, in response of the petition made from the co-management committee, they promised to forward it to the provincial health department, and in response, the provincial directorate sent a team to repair the incinerator, which was repaired and returned to the functionality. But recently, again, in one of the activities in the community, the same complaint related to the management of hospital West was broke, and up again, the danger to the public health still remain. So once again, we have gone to try to solve the problem again, because the main problem is related of the capacity of the district to manage the incinerator when it sorry, I saw here that some of you don't hear me correctly, but I was saying that once again, or recently again, in our activities in the community, the same complaint related to the management of the hospital West, and they say that the hospital West was broke up again, and the danger to public health still remain. So together with the health committee and the person who is responsible for the patient office, we got in touch again with the person responsible for public health at the sanitary unity, and the person responsible for the management of the hospital west to understand what is happening again. And they stated that the incinerator had broken down again, and they are difficult in repairing it due to the high costs and damaged equipment involved. So we've gone back again to the co-management committee, and it decided to draw up a petition again to the district so that pending the availability of funds for repairing the incinerator, we'll propose them to build incinerator of wasting medical waste. So we are currently waiting for the response, but we proposed them to build an incinerator with a conventional material, but an incinerator that is useful for us or for the district. In it, in incinerator which won't need a lot of funds, for example, to be repaired when it be broken or when it goes down. So we are now waiting to receive an answer from the district level. Thank you.
Thank you, Geraldo. Thank you.
Yes,
Really powerful contributions. And congratulations on all the work. Is there another colleague from?
Hello.
Yes, please go ahead. I just wanted to share. Obviously, it's already been an hour and a half, so we want to get all the way around the house, and maybe we'll put the rest of the agenda to our next call. And so, if everyone can be rather brief in their remarks, that would be wonderful. And I promise you, we'll circle back with a date and a time to pick this conversation up to get to the rest of our agenda. Over to you, Fatima.
Hello. Hello.
Go ahead, Eduardo.
Before yeah, so I would like to share some challenge as management, so that to have a space to talk about the challenge with other colleagues, or in terms of how to involve the individual clients during the process of resolution, because sometimes we are facing a challenge to involve individual clients. So here in Mozambique, we have two kinds of clients: the collective clients and individual clients. The collective clients, we talk about village health committee. So this group are recognized by the Minister of Health as a group to make a link between community and the health facility. So most of our clients, it's make a part of those committees, as I mentioned. So what they're asking now, the other countries or other approach, Tanzania, Kenya, and Sierra Leone, how to navigating the individual clients, just to involve them during the process of the resolution. Because here in Mozambique, sometimes they are fear a retaliation for the providing service. Sometimes they say that we haven't the time. We don't have a time to go with you to meeting the health authority, for example. And so what you are doing just to reach the individual clients. So because here in Mozambique, it's a big challenge for us to involving them. And what we're supposed to do, it is to empowering them just to have a knowledge and how to solve the similar problem in the future. So in this case, we are facing the big challenge to involve them. So in Kenya, Sierra Leone, Tanzania, what they're doing just to involve the individual clients. Thank you.
Thank you, Eduardo. I think that's a really powerful question. And I'm going to maybe jump to our colleagues in Tanzania, and they can share some of their own challenges, the reflection that Eduardo just put, and equally ask additional questions of your own that you might have for the rest of the House to consider.
Thank you. Thank you so much. Thank you so much. All right, so we will jump and hear what our colleagues from Tanzania have to say. And please allow me to now shift to Kiswahili for them, and then I'll come back to English for everyone else. Karibuni sana washiriki kutoka Tanzania. Sasa hivi ndo muda wenu. Karibuni sana tuwasikilize, muweze kujumuika pamoja nasi na kutuambia ni changamoto gani, ni swala gani kubwa sana ambalo mnaliona sasa hivi au mnalishughulikia mkiwa mnaisaidia jamii kwenye masuala ya afya, masuala ya kisheria. Karibuni mtueleze na pia mtuambie changamoto gani mnazozipata na je, namna ya kutatua hayo matatizo. Karibuni.
Thank you. I'm Assunta Peter from Tanzania, working at Makole Health Center. Yeah, among the most problem at our health centers is few number of health workers. Yeah, so due to few numbers of health workers to our health facilities and dispensaries, this can lead to patients to not get the good service. And as you know, good service is the right to patient. All patients should get the right service and then the good service. So, at our health centers, due to few numbers of health workers, we don't get enough time to talk to our patient or to listen to our patient, to understand their problems. And due to this problem, we need our health centers or dispensaries to employ many health workers or a lot of health workers, so all patients they can get the right to their service. So as you know, all patients should get the right to be listened, to be answered all the questions, and get the right information about their problems. Thank you.
Asante sana. Thank you so much. Karibu tusikie pia kutoka kwa Ali. Ni Ali Omari. Karibu. Unaweza ukaongea kwa Kiswahili, alafu mimi nitatafsiri kwa Kiingereza. Au kama Kiingereza ni sawa pia unaweza ukaongea. Karibu. Kiswahili, sawa. Karibu kuongea alafu mimi nitatafsiri kwa wengine. Karibu sana. Karibu, tukusikie.
Naanza.
Ndio.
Watu wengi kukosa huduma.
A lot of people miss these facilities.
Kutokana na gharama.
Because of the costs, the high costs.
Katika mahospitali.
In hospitals.
Solution.
The solution.
Gharama ipungue.
Costs should be affordable for patients so that the patients can get good services.
Yeah.
Yes. Asante sana, Ali. Another problem is the health insurance coverage not many people have health insurance, especially in the rural areas. Asante, karibu tumsikilize na mwingine, karibu sana.
Changamoto ya kuwepo ni
the other challenge,
ukosefu wa madawa katika baadhi ya hospitali.
The lack of sufficient medicine for patients in clinics and hospitals. We don't have enough medicine.
Solution yake ni kuongeza upatikanaji wa dawa katika hospitali kutokana na wagonjwa kuwa wengi.
And the solution is to ensure, and this is from national actors, the governments, to ensure that there is enough medicine, there are enough medical tools in the rural areas for all the patients, because the patients sometimes outnumber the medical facilities and tools and even medicines in clinics and hospitals.
Thank you.
Thank you. Karibu sana. Yes, Karibu Aisha, welcome.
Thank you. If Cletus Nziku is online, can he talk please? Because he's joining from directly.
Yes, we also had another member from Tanzania who was supposed to join us earlier. Cletus, I believe he had joined. I don't know if he's still on right now. Cletus,
no, he's not on.
He's not on.
He
might have dropped off. Okay. Let me try to reach out to him again. I think he can even post his contributions in the chat box. Let me just reach out to him again. In the meantime, Aisha, you're very welcome. Would love to also hear from you. And you can give us your input and your feedback with regards to the comments that have already been made on the health challenges or challenges with provision of healthcare services in Tanzania. Karibu.
All right, thank you. As we all know that universal health coverage is a problem to many of the African societies. As previously spoken, that we should, as Tanzania, we should advocate for more people to have their health licenses, health insurance, so that they can get quality treatment at a very affordable price, but also assured treatment. I guess that's all I can add on this.
Thank you. Thank you so much, Aisha, for your great input. I think the only other person missing is Cletus, and he will give us his input in the chat box just for the sake of time. And yes, so to the rest of our members in the platform, that was from Team Tanzania. Those were the challenges and the inputs that we were able to give at the moment. I would just like to conclude very briefly that, yes, in Tanzania, a lot of focus, I can say, tends to be in the cities, in the big towns, and then we tend to forget the people in the rural areas. And this problem is even seen in the education system, because a lot of times when nurses are being educated or medical students, a lot of times the perception is that I'm going to work in a big fancy hospital, I'm going to be a big fancy doctor. And not many people even want to work in the villages or in rural areas. So that is still a problem. And personally, I also think the education sector needs to improve and needs to make sure that once you're training people in this area and once you're training people in this career, they need to know that they are serving the community. So it's not really about, being in one particular place and disregarding another place. We need to make sure that even in the outside of towns, outside of the big cities, where the local communities are, there is enough healthcare workers, which is not the case at the moment. So that also needs to be done. And then also the provision of medicines and tools and access to medical resources. I say this also personally because I know it is a challenge. My mother is a pharmacist, and she was working for so many years with an international NGO in Tanzania, and she would travel. They had so many projects where they would travel to the different parts of Tanzania outside of, the capital city, outside of Dar es Salaam. And she would tell me that you go to a clinic And oh my goodness, they don't even have a shelf full of medicine, just a shelf. They don't have it. So you go to these other different places and you see that the challenge is really, really big. And in the rural areas, you have so many people in a village center, in a district center, you have children, you have young people, you have the elderly. You know, how many times do we focus and think about the elderly, but when they go out looking for these healthcare services, there are not enough resources. That is still a very big challenge in Tanzania. So when we have these discussions, when we have these projects, when we have these movements where we can link up with different organizations, different countries to learn the tactics that are being used in Kenya, in Sierra Leone, in Mozambique, it also really helps us to see how we can be creative and how we can find ways to make sure that the community is being served and that we are using creative and productive ways to reach out to the community. So thank you all very much. This is very productive and very insightful. Thank you from Tanzania.
Thank you. Asante sana. Thank you, Tanzania. Really wonderful to hear your contributions. And our colleagues from Kano, Nigeria, would you like to come in and share a bit from your side and individual cases that you've worked on? And just to say that we're aiming to round up in the next 10 or 15 minutes. So keep that in mind.
Okay, hello everyone. The paralegals will be sharing their experiences. We are starting with paralegal Halima.
The problem is that the challenge in my community is I have problem with police because they see leaders. And clients, sometimes we have problem with our client because sometimes our client used to withdraw their cases from the paralegal services before conclusion. This is another problem that we are facing in my community. Maybe they are withdrawing it because of their of traditional belief or something else. That is the major problems or challenges that I have in my community.
Thank you very much, Halima. I'm moving on to Kamisu, Kariga Kamisu.
Hello everyone. I remain Kamisu Alasan, a paralegal from Warawa local government and joined by Isawali Empowerment Initiative. As one of our colleagues from Tanzania or Mozambique, our challenges is we have an issue with our politicians. The politicians in our community used to bring problem onto our cases. We may have a case and take the case to the police station. So they called the police divisional officer and said that the person on the 10 is our boy, so that you should release him. So this is the problem we are facing with our politicians in the community. And apart from this, I worked with a correctional center at the prison before the name changed to correctional center. So when going there and try to meet the inmates, since our target is awaiting trial persons, so the staffs of that very correctional center used to see us also as spies, as my colleague said. So we have a lot of issues. We ever report the issues or the problem we faced to the office, and the office wrote the letter to the correctional center commander. So he called a meeting, an emergency meeting with we paralegal and welfare officers. So he told them that we are here to help them in getting the contact of that inmate, or to establish the contact to establish the contact of that inmate. So we do our services in the correctional center with all those challenges, and we also have a lot of success during that for our legal services at the correctional center. Thank you.
Okay, hello. In summary, they were just talking about challenges we face with the government, with our client, and the police. Like they said, both of them mentioned police. So this is what they go through, a bit of what they go through as their challenges. So there are more, but to address these challenges, I want to share what we do. We engage those stakeholders in engagement meetings so that we discuss those issues with them to know where the challenge is coming from. Maybe it's a misunderstanding or misconception. So we try to clear that during our meetings. So we engage them more because we don't want our paralegals to be facing such challenges that will withdraw them from wanting to work from wanting to work as paralegals anymore. So thank you very much. I think my assistant has something to add.
On health issue, as we discussed, there are some traditional beliefs down here that were very, like, I can say barbaric in nature, that will not allow some people to have access to enforce their legal rights. For example, as rightly mentioned by Paralegal Halima, she talked about traditional beliefs that make people withdraw their cases. And those traditional beliefs usually tend to tell the clients that, people tend to tell clients that, like in rape cases, for example, I can say, they will tell the victim that they are trying to disgrace their own families, and so they should withdraw from that case. So, and another issue we are having down here is ICT. We all know that the world now is living in a technological era where most things were made online, and people from the grassroots don't have access to smartphones that they can use those newly established platforms for them to get enrolled. For example, we have an issue with the COVID-19, where people, before getting vaccinated, will go online and register. So sometimes it's an issue down here, and hospital services were not free, as it was just stated, because it's more of theoretical than practical. We can see it in theory that hospital services were free to some certain people, but in reality, they were not free, because in this part of Nigeria, in Kano, we have an instance where a victim of rape will be asked to pay for his medical services, which is very unfortunate and very unbecoming. And the hospital facilities sometimes were very poor, to the extent that even if the medical personnel want to help people, they can't do that due to lack of enough medical facilities. And that is what I want to add from what they say.
Wonderful. Thank you very much, and a good day to our colleagues in Kano. And a big round of thanks to everyone that's here. And we're just about at the 2-hour mark. So, and we're not going to go around again as we had thought to talk about kind of successes and strategies. And we'll reserve that for the next time we all meet together. And lots and lots of common themes around corruption and charging for free services, and challenges around traditional beliefs, challenges around the rural-urban divide, and not many people having health insurance, and lack of medical supplies, lack of facilities or broken down facilities. And I think probably as we are each listening to their contributions from one another, we're all saying, wow, yeah, that one also happens here. And I think that solidarity is really an important piece of the work that we're doing, because it's always very challenging, and it's good to know that there are other people out there fighting the same fight, so to speak. And I'm going to propose that we reconvene at another date to talk about strategies and successes more than we have today, because I think that all of us have a lot to share and a lot to learn from one another as well. And so with that, I want to again say a huge thank you to everyone that was able to make it today. Thank you for taking the time, particularly those that traveled from outside their community down to an office to make it online. It's really an honor to be able to hear your contributions and perspectives. Thank you to colleagues that are participating in another language that isn't their primary language as well. It's really wonderful to hear your contributions. And Amy, any final words from your side?
No, Andrew, just to thank everybody for coming, and this was a very insightful conversation. And I know you said that the deeper discussions and strategy should happen in another call. We should reconvene. But already when people were sharing their stories, you can tell the kind of strategies that are used. A lot from Sierra Leone was, discussion, dialogue, mediation, if you will, and navigating the system, and also now including the youth. I really liked the example of the men cleaning the clinic and not the women. But you see, it's a homegrown solution. Also, when Sierra Leone was talking, I'm like, but what is the role of the government then? If we take up all the role of the government, I feel like they're abdicating. But I guess we work with our different contexts. Again, another example that came out quite strongly was from Mozambique team, where they use dialogue, where there was a problem with waste and there was dialogue. There's a problem with the leaking roof. The hospital wasn't built quite well. There was the issue of dialogue and navigating the system, but also using the weight of an NGO. When IWA writes a letter, then somebody is bound to move, as opposed to if an individual like Amy was to write a letter, then it doesn't really have any effect. So the strength in the NGOs is also quite something. We saw that in IWA, and we've seen that also more specifically in Mozambique, the strategy of using the community, when they wrote the letter to do the broad advocacy and involving the community. So a lot of challenges, yes, that were common and they cut across, but also there were distinct strategies that maybe, as you said, we could reconvene and discuss later. My best solution was the one by Ile Ola, where you use subtle threats and say, if you don't help me and something happens to me, my spirit will hunt you. So a nice soft pressure point to scare somebody into doing something. And as we say here in the continent, we don't play with Nigerians when they say that. If they told me that, I would act immediately. So thank you for sharing your experiences. This has been quite rich. And I really, really hope we continue to keep this group and continue, to share these experiences.
Thank you. Thank you.
Thank you.
Thank you.
You know us Nigerians with putting costs.
Alice, we are cornered you.
Okay, who are those ones speaking Hausa? All right, bye.
I
Hi. Yeah, Aiki. When will you be coming so that they don't get lost? They don't understand Hausa.
We're coming soon.
Okay, we'll be waiting. Thank you very much. It was very interesting. All right, bye.
I learned so much. Thank you.
I will.
Thank you.
Bye.
Bye.
I feel that next time I'll become a lawyer because I understand that everyone here is a lawyer.
No, we are not.
I really know everyone is a lawyer.
We're health advocates.
Most of us,
I guess.
some of us are lawyers.
Yeah. But next time we should speak a bit of Portuguese and some of us should learn Swahili and Hausa. Yeah.
Yes, we should learn.
Oh, in Hausa, yes, we should be learning of each other.
I love
Language. I love
Tanzania. I love the language.
Tanzania. I love the language.
Swahili.
Accent of the Kiswahili.
I would like to learn.
The accent of the Kiswahili.
Yeah, the Swahili. So maybe I will learn from them. Yeah, I could. Maybe I will put it in my wish list.
Yeah, we shouldn't have meetings in colonial languages. We should all learn Kiswahili.
Yeah.
By the way, the UN recognized Swahili as an official language, something along those lines. So everybody in Africa should speak Swahili.
Yeah. Okay, that would be a punishment because we can't speak.
I heard someone say Kiswahili. Amy, what's going on?
I'm saying everybody here should speak Kiswahili, and Hafsat is saying Kiswahili is hard. When says my sister, no wahala, you learn, you learn.
I'll teach all of you how to speak Kiswahili.
If you learn Hausa.
Very simple. I'll teach you.
Are you ready to learn Hausa?
Yeah.
Yes, I am.
Okay. I'll learn Swahili then.
Yes.
And from my own end, I'm started learning Swahili today. I know Asante Sana.
Asante. Thanks, guys.
Okay, everyone. Thank you.
Asante.
Bye.
Thank you.
Okay.
Asante.
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 To learn Swahili.
Tanzania.
Bye.
Bye.
Thank you.